I'm James Taylor. We're in Leeds currently at our practice called The Dentist in North Leeds. I'm a clinician, I'm a GDP. I'm the UK clinical expert for SureSmile, but I run a multidisciplinary practice, so I really get involved in all aspects of orthodontics, restorative treatment, CEREC, CAD-CAM, and we're KOLs for both CAD-CAM and orthodontics. Also place implants and just run a very busy practice and using digital integration to really allow us to grow the practice and to enhance the treatments we provide patients. So we do a lot of SureSmile treatment, and all our patients we chat to, we demonstrate SureSmile, but the simulator really allows us to demonstrate exactly what we can achieve moving forward through treatment. So we can explain how the teeth are going to move, and we can show them on the screen before and then the after, and that's when we kind of get the wow moment, when they see really what's achievable from SureSmile. And so as a way of growing the practice and achieving more acceptance for patients, they can really then just really be involved and really understand how they're going to look. And by also, we can then forward them the plan, they can look at it on the phones, and we can discuss in more detail. So it's not just a case of us chatting the surgery and hoping they can visualize the before and after, but actually we can actually physically show them it. And it's engaging, the software's good, and as we develop the software more and we use it more, we'll engage more patients in that and really enhance how we really inform the patients and show them opportunities that SureSmile can give them in terms of improving their smile, improving their width of arch, the way they bite, and really give them a lovely result in a treatment. But they get to appreciate that before they even start. The beauty of PrimeScan 2 is that it's cloud native. Now what that means is that we scan the patient and the servers in the sky, as I call them, the Google server, is actually processing that data. That's very technical, but what it means is that I can scan the patient in my chair. I can use any screen to show me what I'm scanning, whether it's a screen from my surgery PC, the laptop, my iPad or my phone can be the screen which actually shows me what I'm scanning. I can then record that, show the patient, but then immediately having scanned, all the processing work is done on my surgery screen on computer, and the PrimeScan 2 can be passed to another clinician immediately. What that means is that we can expand the practice with only doing one PrimeScan. That allows us to multi-work and really do multiple surgeries in one go. For example, if we have an open evening for SureSmile, we can use one PrimeScan, we can scan different patients in each surgery, allowing us to do multiple chats and initial appointments, giving patients an indication of what the SureSmile Simulator can achieve, showing what SureSmile will do, and therefore allows us to really just enhance the offering to patients. As far as growth and profitability concerned, it allows us to just do more really, do more in a small amount of time and for a lower expense as far as, I guess, the equipment's concerned. We have 2 PrimeScans currently and 2 machines in which we do CEREC, and yeah, now we can do it on one PrimeScan. 2 makes it a lot better for us. So DS Core allows very close collaboration with clinicians. I'm the UK clinical expert for SureSmile. I work with other clinicians on a one-to-one basis. I also assist other clinicians with their cases in complex cases. For example, a clinician approached me, they had a case that was complex. I saw their patient take a CBCT scan because they didn't have a CBCT scanner. I then sent them that scan on DS Core, which they can then upload to SureSmile, and then we can both share and look at the plan together. In other instances, if I've got a problem with my cases and I get advice a lot from other clinicians, there's a couple of specialists I would use and talk to, I can easily send my scan, my x-rays through to them with specific questions, asking advice. And it's very easy, just share, send an email address, and it'll be downloaded on the other side, having put in a password. So the sharing through DS Core is really easy. It's server-based, so I'm not having to upload files myself and then use a different third party to actually send them across. It's all on the cloud through DS Core, so it works really well. We use DS Core a lot for all aspects of our treatments. Now, not only do I do SureSmile, but I do other types of restorative dentistry as well. So the beauty of the canvas on DS Core is that I'm able to put lots of different information into the canvas to inform the patients of different aspects of what we're doing. Because when I treat a patient with SureSmile, I'm not only looking at the teeth, I'm looking at the overall aspect, the overall smile. We may do bonding afterwards, we may do crowns, we may want to draw changes that will help explain to the patient that not only are we moving the teeth, but there's pre-treatment and post-treatment as well. And to help them understand the aspects of that, Canvas allows us to send both the scan, we can send screenshots, we can send photographs, drawings, comments, marks, and therefore we can build a picture of not only the actual SureSmile part of the treatment, but also what happens either side of that. And being a multidisciplinary dentist, it's very important that we incorporate all aspects of the treatment in our consent, and Canvas forms a good part of that because the patients are well informed of not only straightening the teeth, but actually we're going to do this before, do this afterwards. And if the patient's not quite clear on that, by drawing it, animating in whatever way we need to, it allows that whole story to be shown to the patient. So it's very useful for us in many different ways. If you're already using a prime scan, then it's very simple to scan your patient and put that scan into DS Core. The beauty of that is it can be shared very easily with the SureSmile Simulator, and it can then be used to actually explain to the patient how to, or what the opportunities are and what they can do, or what you can do to achieve the smile and the alignment of the teeth that they're looking for, the patient wants. It just gives you another way of communicating with the patient. It's a workflow that will progress from scanning the patient through to having a simulation, and then you can also use that simulation as a baseline to actually produce the actual SureSmile aligners. So for someone that's new to SureSmile, it is a seamless workflow over a period of time that allows the patient to interact at each stage and gives the clinician confidence that everything is in the same portal, it's in the same platform, and therefore it simplifies the actual process for them quite nicely. So really the ability of DS Core really is vast. I mean, there's no limit to what it can achieve. We can use it for the before, the during and the after treatments. The Prime Scan 2 allows us to scan at any time, and it's always free because it's a very quick scan. It works really quickly. You can use it in any surgery and it's shareable, which is great. So I'll always have the Prime Scan 2 available. The DS Core aspect allows me to provide my patient's information, other laboratories information, but also allows me to push it all through as a workflow into SureSmile and order the aligners as well. So I'm really looking at a system and a network that gives me everything I want really moving forward. Patients love the fact we do a lot of tech. They really enjoy it. Everyone has tech, everyone has phones and iPads, and so the fact we are incorporating the latest tech into our practice shows that first of all we're investing in our patients. We're investing in the time to really give the patients the best real treatment and care that we can. And so they react really well to that. And also it gives us tools to really enhance the whole experience. And so patients, when they come in and we scan them, they're like, wow, you can scan like this. Then I explain this cloud native scanning, then they're like, wow, wow, wow. And then we show them the simulator, and if we get a proposal that they like, which will give us, and hopefully they'll be like, wow, wow, I want to go ahead with treatment. So there's lots of wows there, but the whole point is it's tech-based, and we're using technology to really enhance the outcome we give to our patients and the experience in the surgery. And we made a point when we established the practice 5 years ago, DS helped us bring all their kit in. They just released Prime Scan at the time. Now this is Prime Scan 2 5 years later, but they've been with us every step of the way. We've used all the kit, whether it's just Prime Scan 2, whether it's SureSmile aligners, whether it's CEREC. We're really using all aspects that we can to enhance our patient experience, and they all react amazingly to it. Let's say a patient will go through a SureSmile simulation, and the SureSmile simulation gives them an indication, and it is really an indication of what's achievable, just so the patient can visualize an outcome. Now, as a clinician, it may not be the final outcome that I'm wanting to achieve, because I need to look at the bite, the tooth position, other aspects as well. But the patient isn't a clinician. They want to know how it's going to look, and the SureSmile Simulator gives me a very good indication as to how it will look, and that's really all they need at that point. The more detail will come once we've agreed a principle of straightening their teeth. We'll then put that through into SureSmile. We'll get a plan back from SureSmile, which is a more detailed plan which will explain the stages, how we're going to do it, and then we have a more detailed conversation with the patient. But the simulator initially is to allow the patients to appreciate the opportunities that aligners will give them and that the SureSmile in particular can achieve, and how that will potentially look in their mouth. The SureSmile plan, we can then discuss that in more detail, looking at really how we're going to get there and the means by which we're going to get there as well, and what the actual final outcome will be. And in many cases, it's very similar to the indicative simulation we've had, but we get more detail at that point, allowing them to move forwards in an informed way. The entry point for us into DS Core is the PrimeScan 2. Now, PrimeScan 2 is a new scanner. It's cloud native, so it's very quick, very fast. The processing is done in the Google servers. And so the machine, it's very light, it allows us to scan the teeth, and that gives us a really quick and fast digital scan. And that can be used either on our screen, you can use an iPad or a phone to see that scan. And it's very portable, so I can use it, my nurses can use it, anyone can hold that scanner really easily, and it's very movable and you don't need particularly good dexterity to use it. But it allows us to capture all the data very quickly, which we then use in the SureSmile Simulator. So PrimeScan 2 for us is an ideal way of getting the data we want in a very quick, fast and effective way.